So tennis elbow is a very common condition. It's a condition that causes pain along the lateral aspect or the outer aspect of the elbow. It's a condition that nobody really knows why it happens, but we do know a few things. One, we know it's a change in the quality of the tendon. So the tendons themselves actually become different. There's a process, we call it, which is angiofibroblastic proliferation. But what all that means is that the tendon no longer is normal. So those tendons that actually power the wrist, causing wrist extension, those tendons no longer are normal at the insertion or the site of the elbow. The typical signs and symptoms of tennis elbow are number one, pain, and number two, pain with wrist motion. So those types of symptoms can occur whenever you're lifting a heavy object, especially if they're objects that are away from your body and also with the palms down. So when we think about treatment for tennis elbow, there's a few simple things we always start out with. The first thing is modifying or changing the activity and trying to avoid those things that actually cause pain. So one easy way to do that is, instead of lifting heavy objects away from your body, bring them closer to you with the palms up. Another way to treat initially tennis elbow is to use splints. And the idea behind splints is really to relax those tendons that originate at the elbow and power the wrist. So when you splint the wrist, you can actually relieve those tendons and allow them to rest and try to recover. Another type of splint or brace is something called a Counterforce Brace. And the Counterforce Brace is used up closer to the elbow, but the goal of that is to decrease the amount of tension that travels from the wrist to the elbow, and it's another alternative to treating it. Most people don't require surgery for tennis elbow. We always start with the basics, like we talked about, non-operative treatment including splinting, bracing, potentially injections, and physical therapy. If all those things fail and the pain has been present for greater than 6 months, we start thinking more towards surgery. Now, even with surgery, that is still the vast minority of those patients. And when we think about surgery, there are several different types. One type of surgery for tennis elbow is a small incision right along the elbow, and we try to generate or stimulate healing around that area by repairing or debriding the tendons around that site. Another type of surgery is arthroscopic surgery, and that uses small cameras that we use into the elbow joint itself, and we can actually clean the elbow tendons from the inside out. Recovery time itself for the surgery is quite fast, so the skin heals within about 2 weeks, but the tendons themselves have to have time to regenerate and also feel better. So that can vary a lot between patients, but generally speaking, it can be about 6 weeks to 2 months.